Welcome to Medigap TV. Real answers about Medicare in plain English. If you have a TV, you've seen the commercials with smiling seniors or sports heroes talking about $0 premiums, dental, vision, hearing, gym memberships, grocery cards. It all sounds pretty good. And I want to be clear right up front. I'm not here to tell you Medicare Advantage is a bad plan. I sell Medicare Advantage plans. I have clients on Medicare Advantage plans, and it works really well for some people. But there are things about how these plans work that the commercials will never tell you. And if you don't know those things before you choose, you could end up in a situation that's very hard to get out of. Hi, I'm Loran Marms. I've been a licensed Medicare specialist for 16 years, and I work across 46 states. Today, we're going to go through Medicare Advantage honestly, completely, and without a sales pitch in either direction. Let's get into it. First, let's understand just how big Medicare Advantage has gotten. As of early 2026, more than 35 million people are enrolled in a Medicare Advantage plan. That's over half of everyone on Medicare in this country. To put that in perspective, back in 2007, only about 19% of Medicare beneficiaries were on Advantage plans. Today, it's over 50%. The growth has been enormous. The reason for that growth is pretty straightforward. These plans are marketed aggressively and they do offer some real benefits that original Medicare doesn't have. But enrollment growing doesn't mean it's automatically the right choice for everyone. It means it's the right choice for a lot of people and the wrong choice for others. That's what we're going to help you figure out today. So, what actually is a Medicare Advantage plan? Here's the simplest way I can explain it. Original Medicare is run by the federal government. Medicare Advantage takes your Medicare benefits and hands them over to a private insurance company to run. That company has a contract with Medicare to deliver your Part A and Part B benefits. So instead of having Medicare itself pay your claims, you now have a private insurance company doing that. The official name is Part C of Medicare. And the key thing to understand is that these plans must cover everything original Medicare covers. That's a federal requirement. They cannot legally offer you less coverage than Medicare provides. What they can do is add extra benefits on top and change how you access care, which is where networks and prior authorization come in. Most Medicare Advantage plans also bundle in prescription drug coverage. So instead of managing a separate Medicare supplement and a separate drug plan, you have one card and one company handling most of it. For some people, that simplicity is very appealing. Before we go any further, I need to address the single biggest misconception that those TV commercials create, and that's the $0 premium. It's true that many Medicare Advantage plans have no added monthly premium beyond what Medicare requires. You might pay nothing to the insurance company on top of your Medicare costs. That part is real. They are paid by the federal government to administer the plans, which is why they can offer them at zero premium. But here's what the commercials never say. You still pay your Medicare Part B premium every single month. In 2026, that's $202.90. That doesn't go away. It doesn't get waived. It doesn't get reduced. Whether you're on Medicare Advantage or a Medicare supplement, you owe Medicare $202.90 every month for Part B, unless you are very low income and Medicaid is paying it for you. So when someone says they found a free Medicare plan, they're not paying anything extra to the insurance company, but they're still paying $202.90 a month to Medicare. When you're comparing plans, always add that $202.90 to whatever the plan's premium is. That's your real starting cost. Medicare Advantage is not one single kind of plan. There might be other options in some areas or states, but there are three main types, and the differences matter a lot depending on your situation. The most common type is an HMO, which stands for Health Maintenance Organization. With an HMO, you choose a primary care doctor who coordinates your care. If you need to see a specialist, you generally need a referral from that primary care doctor first. And for non-emergency care, you have to stay within the plan's network of doctors and hospitals. Going outside that network for regular care typically means paying the full cost yourself. HMOs usually have the lowest premiums of the Advantage options. The second type is a PPO, which stands for Preferred Provider Organization. A PPO gives you more flexibility. You don't need referrals. You can see out of network providers, although it'll cost you more than staying in network. PPOs generally have higher premiums than HMOs, but give you more freedom in who you can see. The third type is a special needs plan, or SNP. These plans are specifically designed for people with certain chronic conditions or for people who are enrolled in both Medicare and Medicaid. If you qualify for a special needs plan, it can be a great fit. But if you don't qualify, these plans aren't open to you. Let me put the two main types side by side so you can see what you're actually choosing between. With an HMO, you need to pick a primary care physician. You need referrals to see specialists. For non-emergency care, you have to stay in network. Go outside the network and you're generally paying the full bill. The upside is these plans usually cost less each month. With a PPO, no primary care doctor is required. No referrals needed. You can go out of network and the plan will still pay, but you will have higher copays than if you stayed in network. More flexibility, but usually a higher monthly cost. The most important thing I tell people when they're choosing between these two is this. Before you even think about which type fits your budget, go check whether your actual doctors are in the network. Your primary care doctor, your cardiologist, your orthopedic surgeon, the hospital you'd want to use if something serious happened. Check every single one before you pick a plan, because none of those premium differences matter if your doctor isn't in the network. Now, let me tell you about Medicare Advantage's single biggest genuine advantage over original Medicare, and that's the out of pocket maximum. Original Medicare has no annual out of pocket cap, none at all. If you have a terrible year health wise and you're on original Medicare without a supplement or Advantage plan, your costs can keep climbing with no ceiling, and that's a real financial exposure that some people on original Medicare alone face. Every Medicare Advantage plan is required by law to have an annual out of pocket maximum for covered services. In 2026, the federal cap is $9,250 for in network services. That's the highest any plan is allowed to set it. But here's the thing, most plans set their actual limit well below that. The average in network out of pocket limit is around $5,320 based on recent data from the Kaiser Family Foundation. Once you hit that limit, the plan covers 100% of your covered medical costs for the rest of the year. That protection is real and it's meaningful. For someone who has a major surgery or a serious illness, knowing there's a ceiling on what they'll owe gives a lot of peace of mind. This is the part that commercials love to focus on. Dental, vision, hearing, gym memberships, over-the-counter allowances, transportation, meal delivery. The list sounds impressive, and some of these benefits are real and valuable. But there's a lot of fine print that the 30-second TV spot doesn't have time to mention. First, the details vary enormously by plan. A plan that says it includes dental might cover 2 cleanings a year and nothing else. It might have a very small annual maximum. It might only work with a specific list of dentists in the network. The word dental on the brochure and what dental actually means in practice can be very different things. Second, these benefits change every year. What's included in your plan this year might not be there next January. Plans are required to send you an annual notice of change every fall. You should receive a letter in the mail mid to late September. And if you don't read it, you might not realize your benefits shifted until you go to use them. Third, and this is important, Medicare specifically warns people not to evaluate a Medicare Advantage plan based on its extra benefits alone. The networks, the copays, the prior authorization requirements, and the out of pocket maximum are all far more important to your actual healthcare experience than whether the plan includes an over the counter allowance. Let me be direct about what the Medicare Advantage commercials are and aren't telling you. What they show you is The celebrities, smiling seniors, lists of extras like grocery cards, dental benefits, cashback, and zero premium plans. What they never show you is the network restrictions, the prior authorization process, what you'll pay at the hospital, or the fact that most of those extra benefits are not available to most of the people watching the commercial. Here's something a lot of people don't realize. Many of the benefits that are advertised most aggressively, things like the grocery card and some of the food and utility allowances, are only available to people who are enrolled in both Medicare and Medicaid. That's called dual eligibility. If you're only on Medicare and you don't also have Medicaid, you may not qualify for those benefits at all. The plan still exists for you, but those specific extra benefits are not part of what you get. The commercials are not technically lying. They're advertising plans that do exist, but they're advertising the best version of those plans to an audience where most people don't qualify for the best version. And they're doing it without ever mentioning the things that actually determine whether a plan works for you in practice. Prior authorization is one of the most talked about topics in Medicare Advantage right now, and for good reason. Here's how it works. With original Medicare, you and your doctor generally decide what care you need, and Medicare pays for it if it's a covered service. There's no middleman approving or denying the decision. With Medicare Advantage, the insurance company gets involved. Before certain services are delivered, the plan may require that a request be submitted and approved. That is prior authorization. The scale of this is significant. In 2024, nearly 53 million prior authorization requests were submitted to Medicare Advantage insurers. That works out to about 1.7 requests per enrollee for the year. In the same period, traditional Medicare processed about 625,000 prior authorization requests total. The difference is stark. About 99% of Medicare Advantage enrollees are subject to prior authorization for at least some types of care. That typically includes things like inpatient hospital stays, skilled nursing facility care, certain procedures, and chemotherapy. Now, here is the nuance. When people do appeal a denial, 80.7% of those appeals are overturned. That means in most cases where someone pushed back, the care was ultimately approved. But here's the catch. Only 11.5% of denied requests are ever appealed. Most people either don't know they can appeal, don't know how, or can't wait because they need the care now. And during all of this, you're waiting at the time you actually need the treatment. New 2026 rules require that standard prior authorization decisions come within 7 days and urgent decisions within 72 hours. That's an improvement. But prior authorization is still a real part of daily life on a Medicare Advantage plan in a way that it simply is not with original Medicare. The network is one of the most important things to understand about Medicare Advantage, and it's one of the things people check last when they probably should be checking it first. Your plan has a list of doctors, hospitals, specialists, and other providers that are considered in-network. The plan has a contract with those providers. When you see an in-network provider, you pay the plan's contracted cost sharing. When you go outside the network, the rules depend on your plan type. With an HMO, going out of network for non-emergency care generally means you're paying the entire bill yourself. There's no coverage for out-of-network care except in an emergency. With a PPO, you can go out of network, but you'll pay more, sometimes significantly more than if you had stayed in network. There are a couple of things that catch people off guard. First, the fact that a major hospital or a well-known cancer center is not in the network is more common than people expect. Always check the specific facility you would want to use, not just whether a hospital category exists somewhere in the network. Second, and this is critical, plans vary by zip code and county. A Medicare Advantage plan that has excellent network coverage in one part of a state might have a thin network in another. The plan available to your neighbor may not even be available to you, and the same plan may have different networks in different areas. This one surprises a lot of people, and it's worth a dedicated moment. Most people understand that plans can change every January, but networks can also change during the year not just at the start of a new plan year. A doctor or hospital can leave a plan's network at any point. It doesn't happen constantly, but it does happen. And when it does, the timing can be very inconvenient. Here's the part that really gets people. If your doctor leaves the network in the middle of the year, that does not automatically give you a special enrollment period to switch plans. You don't get to leave. You're generally locked into that plan until the annual open enrollment period in the fall, which means changes would take effect January 1st of the following year. So if your cardiologist leaves the network in March, you're looking at potentially 10 months before you can switch plans and get back to seeing a provider you're comfortable with. In the meantime, your only real option is to find a new doctor within the network. I'm not telling you this to scare you away from Advantage plans. I'm telling you because this is exactly the kind of thing you need to know before you choose, not after. Let's talk about plan stability, because this is another area where Medicare Advantage works differently than what some people expect. Every year in the fall, your Medicare Advantage plan is required to send you an annual notice of change. This document tells you what's changing about your plan on January 1st. And things do change. Premiums can go up, copays can increase, your deductible might be different. The formulary for your prescriptions might shift, and as we just talked about, the provider network can change. The practical takeaway is this: just because a plan worked well for you this year doesn't mean it's still the best option next year. During every annual open enrollment period from October 15th through December 7th, you should actually compare your current plan against what's available in your area. It takes some time, but it can save you a lot of money and hassle. If you're not reviewing your coverage every year, you might be paying more than you need to, or staying in a plan that no longer includes your doctors at the same level it did when you enrolled. If you're finding this video helpful, go ahead and hit the like button and subscribe so you never miss a video. We put out new Medicare education every week right here on Medigap TV. Now let's talk about who Medicare Advantage actually makes sense for, because it genuinely is the right answer for some people, and I want to give you a fair picture. If you're looking for the lowest possible monthly cost and you're comfortable operating within a plan's rules, Advantage can be a strong fit. The combination of a low or $0 premium plus a drug plan included in one package is genuinely attractive for someone who is relatively healthy and doesn't expect to use a lot of specialist care. If your primary doctors and preferred hospital are already in the network of a plan you're considering, that removes one of the biggest practical concerns. Check it carefully first, but if the network lines up, you're in a better position to start. And if you want everything in one place, medical coverage, drug coverage, and some extra benefits all under one plan, Advantage was designed for that kind of simplicity. For people who don't want to manage multiple plans and multiple bills, there's real value in that. Now let's be equally honest about who should probably think carefully before choosing Medicare Advantage. If you travel a lot or you split time between two different states, a local network plan can create real problems. Your network in Wisconsin is not your network in Florida. A PPO plan might give you some out-of-network flexibility, but it comes at higher cost. And some plan types give you essentially no coverage outside your home area for non-emergency care. If you have complex health conditions, you see multiple specialists regularly, or you're dealing with an ongoing illness that requires a lot of coordinated care, the prior authorization process and network restrictions can become a real burden. Not impossible to navigate, but genuinely more complicated than it would be on original Medicare with a supplement. And if you value predictability in your costs, the copay structure of Advantage plans can work against you in a bad year. A year with surgery, extended rehabilitation, multiple specialist visits, and prescription changes can add up in ways that are hard to predict at enrollment. The out-of-pocket maximum does protect you from catastrophic costs, but the path to that maximum can be bumpy. This might be the most important slide in this entire video, so I want to make sure it lands clearly. A lot of people approach Medicare Advantage as a trial. They figure they'll try it out, and if they don't like it, they'll switch back to a supplement plan later. That thinking is understandable, but it misses something important. You can leave Medicare Advantage and you can drop your Advantage plan to return to original Medicare during the annual open enrollment or the Medicare Advantage open enrollment period. That part is true, but returning to original Medicare is not the same as being able to get a Medicare supplement plan. In most states, once your Medigap open enrollment period is closed, you have to go through medical underwriting, which is answering health questions on the application to buy a supplement. That means the insurance company can review your health and prescription history. They can charge you more based on your health conditions. And in most states, they can deny you coverage entirely. There is something called a trial right that applies in specific situations, primarily for people who are new to Medicare Advantage for the very first time. But this right is narrow, it has specific conditions, and many people who think it applies to them find out it doesn't apply to their exact situation. The bottom line is this: Medicare Advantage and Medicare Supplement are not equally easy to move between. If you go the Advantage route first and decide later that you want a supplement, you may find the door is harder to open, or that it won't open at all depending on your health. That's not a scare tactic. It's just how the system works, and it's better to understand it before you choose than after. Before you enroll in any Medicare Advantage plan, there are 6 questions I want you to have answers to. Here are the first 3. Question 1: are my specific doctors, hospitals, and specialists in this plan's network? Not the category, not whether doctors exist in the network, but your actual doctor's name, your hospital, your cancer center, if that matters to you. We need to look it up on the plan's provider directory or call and ask directly. Question 2: what is this plan's maximum out of pocket limit? And if I use out of network providers, what's that limit? Because some plans have one cap for in network and a much higher cap if you go outside the network. Question 3: what requires prior authorization under this plan? Ask them to send you the list or look it up on the plan's website. Knowing whether a surgery you might need or a specialist you regularly see requires pre approval is information worth having before you're already in the plan. Here are the last 3 questions before you choose. Question 4: are my prescriptions on this plan's drug formulary, and at what cost tier? Pull out your medication list and check every single drug against the plan's formulary. A medication that's in the plan's formulary today might move to a higher cost tier next year, but at least you'll know where you're starting. Question 5: do I travel often or spend significant time in more than one state during the year? If the answer is yes, a local network plan may create real problems for you when you're away from home. Think honestly about your habits before you commit. Question 6: if I skip the Medigap window now and want to come back to a supplement plan later, am I comfortable with the fact that it may be harder or more expensive to do that? This is the one people most often underestimate. Be honest with yourself about your answer before you make the choice. Here's the thing about Medicare Advantage that makes it genuinely impossible to give you a complete answer in a YouTube video. The plans, the networks, the premiums, and what's covered are completely different depending on where you live, not just by state, by zip code, by county. Someone in a rural part of the state might have 1 or 2 Medicare Advantage plans to choose from. Someone in the city might have 40. The networks are different, the premiums are different, which doctors are in network is different. I cannot tell you whether Medicare Advantage makes sense for your situation without knowing your zip code, your doctors, your health, and your medications. That's exactly what the free call is for. When we sit down together, we pull every Medicare Advantage plan available in your specific area. We check your doctors and hospitals against each network. We look at your prescriptions against each formulary, and we compare those plans against the Medicare supplement options available to you so you can see the full picture before you make a decision. Most people come in thinking they already know what they want and leave with a much clearer understanding of what actually fits. That's not because I push them anywhere. It's because having real numbers in front of you is different from watching a commercial. If this video gave you a clearer picture of how Medicare Advantage actually works, hit the like button and subscribe so you never miss a video. We put out new Medicare education every single week right here on Medigap TV. Ready to find out what Medicare Advantage plans are available in your area and whether your doctors are in the network? That's the only way to know if it's really the right fit for you, and it's what we do on every free call. All the links are in the description below. Option 1, book a free plan comparison call directly on our calendar. We'll pull every plan available in your zip code, check your specific doctors against each network, compare your prescriptions against each formulary, and walk through the real numbers side by side. There's no cost and no obligation. The Calendly link is right there in the description. Option 2, take the free Medicare Clarity Quiz. 7 questions, about 2 minutes, and you'll get a personalized starting point based on your situation. The link is in the description. I'm Loran. 16 years doing this, 46 states. I sell both Advantage and supplement plans, and I have no financial reason to push you toward either one. My job is to help you find the right fit. Thank you, and we'll see you in the next video.